Our team, welcome back to Plastic Surgery Untold, the greatest podcast in the world as voted by us. Today we're talking about a little topic called QWO, which we led into at the beginning of Hot Products out for 2021. And guess what? It's out, so we're talking about it because...
Boom, baby.
Yeah, we have to. I'm Dr. Johnny Franco, also known as Austin Plastic Surgeon. Unfortunately, we have our celebrity cast back with us again. So let's start around the horn here. So we got Austin's most beautiful man, one Gilberto Sainz, who I think this week actually got confused for another guest member who we've no longer let come onto the show because he said it felt like being mauled by a bear being on the show. But what's going on with you?
Not a whole lot, just same stuff, working a lot, and I
working a lot. He has every Monday off. So just to put in perspective for those of you that are working a full 30-hour work week, Gilberto's struggling with this 20-hour work week. But continue.
So those other 4 days of the week, I'm working. Thank you very much.
If you could switch one more day, you will have beat the system.
100%.
If I can work Tuesday through Thursday, then that would be
now we're
money.
talking.
So what do you do with your free time? I heard you've picked up a new hobby called pickleball.
Yeah, started playing pickleball yesterday.
How
Pickleball?
Yeah.
Clarify.
I'm impressed that you don't have a cast, you don't have a wrist splint.
I'm athletic, John.
Okay.
You may not know this, but I'm athletic.
No, your mom DM'd us and said that to make sure that you took your splints out, pack you some water, and you were ready to go. So between that and your Tinder account, which we'll get to at the end of the show, I heard life's going good for you.
Life is good. She packed
wait.
She packed me some
Explain to
peanut
me-
butter and jelly, some Gatorades.
Explain to me what pickleball is.
So it's like tennis, or it's like mixed between tennis and ping pong. Imagine yourself playing ping pong, but you're like standing on the table.
Okay.
It's like a smaller court. You play with a wiffle ball instead of like a tennis ball or a
So
ping pong
tennis
ball.
for lazy people.
Exactly.
I've actually never played pickleball, but all of my patients in Sun City, when we used to live in Arizona, I'm not saying anything bad about pickleball, but I think like it is huge.
It's
in
blown
the
up.
over 70 population.
Yeah. No, it's even blown up in the younger population too.
Okay, very cool.
But when you play the older folks, you have
They're
a little bit of an
slower?
advantage.
Okay. That's fair.
On that note, celebrity,
What's
what's
up?
been going on
What's
with you? Sounds like business has been going crazy for you because I try to get a hold of you and I go to voicemail and occasionally I'll get a text saying, please set up a time to talk to me with my assistant. That's why we're also filming here at like 6 in the morning because it's the only time celebrity could work us into his busy schedule. So
That's
thank
exactly
you.
right. I appreciate you guys being flexible.
Appreciate the studio, letting us come in before the sun comes out.
Absolutely. Zero Dark 30 seemed like a great time to record this. Business has been really good. Picked up a couple other surgeons that we're working with. One other surgery center here in Austin, which has been really nice to work with. And just getting new contractors on board and getting everybody oriented and getting everything going. It's a lot of work, but it's been fun.
Awesome, man. Well, I'm excited for you. Congratulations.
I appreciate it. That's awesome. Yeah.
It's always, exciting, nerve-wracking,
Oh.
headache, enjoyment, all rolled into this, like, it's almost like a gumbo explosion of, like, emotions, if you will.
It is. And then I look up, and at the end of the week, I'm like, oh my God, it's Friday. And I've just been pulled in 1,000 different directions. And I've been the accountant and the executive and this guy and that guy. And
You're everything
it's
from
just-
El Jefe to El Janitor.
That's exactly right. Dr. Franco and I have talked, for several years. We kind of have this running thing that the bigger you grow a company and the higher that you get in a company, the more people you actually answer to. And that has never been more true than where I'm at right now.
All right, cool, man. I'm excited for you. Tall Gamer, what's going on? We let you back in. For those of you that watching on YouTube can see the Tall Gamer dressed up for the occasion. So appreciate you breaking out the nice red sneakers, and I got the same pair for my one-year-old niece. So
hold on,
you two actually have matching shoes. So boom, 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 you look great. Okay, let's get started with this podcast. I'm just kidding. Tall Gamer, get your 30 seconds and go.
Coming from the guy in scrubs. So I've been pretty
Boom.
busy. Last week, finally announced the game that I've been working on for the last 6 months.
I saw that on Twitter. I
So-
got your Twitter on my alerts. It was like, damn. I was like, stop everything.
Yeah.
Stop clinic. I was like, I gotta send a message to Tall Gamer.
Yeah,
we were driving. I made Mary pull the car over. I was like, hold on. I've got a new alert.
I appreciate and love the support, guys. It's been a long 6 months.
Wait, what project is this?
So this is all right. See, off the Christmas list.
Got him.
No, it's Ruby Grim Eclipse for the Nintendo Switch, and we were partnering with local studio called Rooster Teeth, and then a publisher called Aspire, and so. I was the executive producer of that, led the team through all of that fun stuff over the last 6 months, and just excited, just super, super excited.
So now that project's over, is this project, i.e. the podcast, gonna get your full attention now?
So yeah, of course. I mean, this project has always had my full attention.
Because this is a passion project.
This
if you
is
will.
this is a love relationship. See, no hate.
And we're going to get into your other love relationships a little bit later. So I'm going to let you guys think about that nugget because there's some goodness that one Donald's been holding out on us. But boom, boom, boom. Let's get into the meat and potatoes here. So today which is probably why you need QWO, but we're going to get into a little product called QWO. This is super exciting because this is actually the first FDA approved treatment for cellulite. And so exciting because cellulite's been something that drives people crazy in general. As you know, I do a lot of butts in my practice, and so it's an area where you can have this phenomenal shape, but with the I feel like leggings and yoga pants and stuff running rampant. And it's not even just in bikini season. A lot of people just want a little bit smoother contour, especially if you work out, do those things. You're like, damn, I look good overall. I just don't want these little lumpy bumpies. So I think anything that can even make it a little bit better is super exciting. We've used Cellfina and a few other treatments in the past, but they were a little bit more treatments per se that either involved blades or cutting or surgical treatments. And this is nice because it's an injectable that people can do. So we'll get into who's a better candidate for which and kind of the benefits and who's a good candidate for QWO. As everything, not everything fits everyone. So I think it's exciting. But G, you want to get us a little started on what QWO is and what's going on and why all the hype and whether it's living up to the hype.
Yeah. So QWO is it's a new innovative product. Actually, well, I'll save this for the behind the bovie, but let's just say it's a new innovative product for cellulite.
So many teasers.
On,
so many
Behind the
teasers.
Movie.
Yeah.
Yeah. But it's a product that's used to treat moderate to severe dimpling or cellulite in the buttocks. So it's kind of just this, really great product that has come out, and I think it's got a lot of potential for just great things in helping to, like you said, help with contouring of the buttocks.
It's just going to expand the Speedo world. I think celebrity will be ready for pool season. The cool thing about it is, much like Cellfina or some of the other treatments that have had a little bit more success with cellulite, other than just, because there's a lot of creams, other things that put out there that just cause some inflammation that I think disguise cellulite. The treatments that we've really talked about and focused in my practice and on this podcast have been stuff that actually treats the source of cellulite. So let's maybe circle back just a little bit to put it in context.
Yeah.
And so
I was actually going to ask you because I get questions. Sometimes
you get a lot of cellulite?
I get a lot of cellulite. No, but I do get questions sometimes from patients. I'll be in the room and, they haven't spoken to the surgeon yet. And they're like, oh, I had a question about some cellulite that I have back here. Can we fix X, Y, and Z? And that's not my specialty, so I always defer that to you. But just from my knowledge, what is cellulite?
Yeah, so cellulite, and this is what it seems simple, but this is actually what's really tricky in terms of treating cellulite, because a lot of things get lumped into cellulite because it's just like any contour deformity in our butt, hips, we call cellulite.
Right.
Not true. Not true. And that I think makes treating very difficult, because I think a lot of people treat stuff that's not cellulite with treatments for cellulite, like Cellfina and so forth, and then they're unhappy with the results. And this is where the consultation is so important. And when you come into our office, we'll mark out and I'll show you, and I have a little light I flash over the butt thighs and be like, this one will get better, this one will not. And that is actually the hardest part, much harder than the injection itself, is being real with people. And then you can decide, and sometimes we'll even mark the ones that will and the ones that won't, and then you can say, yeah, I want to do it, or no, I don't,
Yep.
But that's the hardest part. But cellulite is actually, you have these fibrous bands that attach to the skin and then to the underlying structures, that fascia. And that's what, if you think about it, it's a tethering band that pulls that skin down. And that's why you get that dimple. And so areas that have very discrete dimples have very discrete bands that are holding those little spots down.
Okay.
there's a lot of mechanics in this, and a reason why more women get it than men. It's thought to be related to estrogen content and some other things. So a little bit beyond this show, because we want to keep it on the fun and stuff that I know a lot about. But when they have very discrete bands, we can treat that. The biggest, I would say, downfall when you're looking at stuff that people call cellulite, and correct me if I'm wrong, G-Bert too, it seems like a lot of people confuse skin laxity with cellulite.
Yep.
A lot of people confuse, especially in the old days where we used to do more intramuscular injections of antibiotics and so forth into the butt. Those can be contour deformities created by a fat necrosis. That's another one that sometimes people, right? So if there's no band, you just lost the fat. Treating the bands underneath isn't going to get rid of the problem. If you have a skin laxity issue, again, treating those bands, whether it's Cellfina or QWO, is not going to treat that because that's not the cause. And so I think that's the biggest mistake: skin laxity, fat loss, and sometimes people just have overall contour deformities from other stuff than the true cellulite. So I do tell people, if you got very discreet, like little hail damage dimples, those tend to go very, very well. Long bands, skin laxity, if you just gently pull your skin up, and now everybody's going to be in the mirror pulling their butt up just lightly, and they go away, then that's typically not a cellulite, because the band's not going to go away by you just gently pulling up.
Got it. So it sounds like the most important thing with this is identifying exactly what spots have that cellulite, and like you said, have the right amount, or the cellulite is either too bad or not bad enough for treatment with QWO. Does that sound about right?
Yeah, and I don't know that not bad enough is probably something we would say. I don't know if the patient would agree with us.
That's fair. That's fair.
And people who have really deep ones, I think it's being super clear that they're going to improve. And I tell this to everybody. If you've had these dimples for the last 40, 50 years of your life, the chances that we're going to do it one injection and make this baby butt bottom smooth is say that fast 3 times, but is very, very, very unlikely. So the idea is to improve it so it's softer, so you don't have those big dimples and that type of thing. If they're super subtle, those are people that are going to do even better. So I think, to your point, being super real about that. G?
No, I agree. I think you have to be realistic with the patient, with their expectations. Otherwise, you're going to have someone who's not satisfied with the end result.
And that's where I think most of the patients that are going to benefit from this are patients that are a little bit on the younger side, people that have good skin tone, because if you have a lot of skin laxity, I think you're going to really struggle. Again, seeing somebody, whether it's your dermatologist, PA, advanced nurse provider, or hopefully your celebrity plastic surgeon, to go over these and really be clear about what you can and can't treat, because people don't mind spending money if it's treating something that really bothers them, but you want to make sure you both are on the same page about what you're going to get for it.
So I got a question now. So I'm going to try and use one of the words that I've heard here before. So the only indication, I assume, is for the butt and thighs. Is there any other locations?
Well, so that, my friend, is not truly accurate. So the current FDA approval is only for the buttock. Doesn't mean that you can't off-label treat the thighs, but the study that got approved was for the buttock. There are some other studies along the way that will be out over the next year or two, probably, where they have looked at the thigh. So again, somebody who's really trained can walk you through whether that's a good option for you or not. But remember, cellulite in other areas, you got to be a little suspicious whether it's truly cellulite.
Right.
Makes sense?
Is there can you, other than like the lifting test, are there other ways that you can go in non-invasively to see if it's actually cellulite, like bands holding it down, or I don't know if like X-rays, or I don't know if that's like too much to go. I don't know.
We just put them in the cellulite scanner.
Yeah.
Is there like a cellulite gun that you can
the issue with what you're saying is a couple is that you gotta the evaluation can't be more expensive than the treatment. So could you get an MRI and look for some of these? you probably could, but to spend $1,500 to evaluate for cellulite when the treatment costs $1,000, probably doesn't logistically make sense. I mean, the day may come. We've talked about ultrasounds here on our practice, which I'm trying to pull the trigger this week and purchase one.
Nice.
I think we'll be there, but it's not. It's not worth paying more for the evaluation than the treatment itself.
Okay.
There's still the old a good provider that can do an evaluation. What you would call let me throw out a historical term for you guys
please.
in the day of CT scans and everything else. Physical exam.
What?
Yeah.
What is
Yeah.
that?
Yeah. Gee, have you heard this?
No, this is all novel stuff for
let's
me.
let's I feel like we got a few lists here. Let me go down these and hopefully G will jump in and help a little bit with some of these. But who's a good candidate for QWO? I'll sum this back up. I feel like we touched it a little bit. Young, good skin. Typically I tell people lower BMI, because sometimes if your BMI is really high, you have some excess adipose tissue around the buttock and thighs, and that makes it really hard to tell what's a true cellulite or not, and you're not going to see as much of a difference. So, that's another one that I would tell people to keep in mind that we hadn't touched about. Also, this is sometimes where the difference between a QWO and a Cellfina. I think it's great for people with a limited amount. If you have a few discrete dimples, I think this is great. In the past, if people only had 3 or 4 or 5, 6 dimples that really bother them, push them away, because I was like, hey, doing a full, Cellfina treatment and numbing up the whole butt and doing this, I thought was a lot for a couple. I feel like this is great candidate for something like this.
Yeah, for like very few. Yeah, I agree.
And typically people with very discrete, just a few, tend to have a tight butt, to have a good shape. And those are also a lot of times people who work out a lot, and they're like, hey, I worked so hard and I got these few little spots, and then it just drives you crazy. And once you get them in your mind, you can't stop looking at them.
Yep.
It's like when you spill something on your shirt. Like, no one else notices it, but you're staring at it the entire rest of the night. And of course, it's a brand new white shirt. Other comments you have about who's a good candidate for this?
I mean, you kind of pretty much touched on it earlier.
You're welcome.
Anyone who has good skin laxity, good skin turgor, they're going to be ideal candidates. Someone who's got just their skin is just much more lax. You're not going to get the same kind of result. I think maybe there's other things we can discuss about what might help with skin laxity, and you've touched on some of that with J plasma and stuff.
I think that the two biggest devices out there that I've seen be effective is the Renuvion J plasma skin tightening device, which are radio frequency energy mixed with some helium to cool it down, which I do. There's another good device out there called Body Tight, which works on the same type of radio frequency energy. They both are a little bit different than other stuff out there because they actually go under the skin. They have a little, kind of like most things, they have a little different way where they get to the end point. The end point is very, very similar. I think, discussion for another day. They both have their place. I think the Body Tight has a little bit more bells and whistles for the office and other things. The J plasma Renuvion, because of the helium mix, I think is a little bit more efficient for surgeries, because as you know, we like to try and limit our surgical time, celebrity, just from a DVT, blood clot, safety standpoint.
And I got to make that tea time at 3 p.m. That's just not gonna happen if we're there all day.
And if the price that celebrity charges us per hour, I mean, for you guys, it's a huge cost benefit. Huge. We're talking huge.
Got to keep the yacht fueled up, man.
He's got a new business to run.
Exactly. But let's talk about what the treatment's like, because I think that's super important for people to know what they get into. And this is where I think the real benefit of QWO is versus other stuff.
Yeah.
With the Cellfina, and I'm a big fan of it. I love it. Is that Tibby had to schedule like a procedure time, because it took about an hour and a half, just depends on how many areas, because numbing the patient, getting the area out, it actually had a blade in a special cup that lifts the skin, cuts those bands, because again, you're attacking those bands, but obviously nobody wants their bands cut without being numbed up pretty well.
Yeah.
The nice thing about the QWO is this is one of those where you could come in and say, let's do it, and then mix up the vial, and then boom, 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 just like a Botox, get injected that day and go on your way. So I think that's where it's really, really, really great in terms of the treatment itself.
Quick question.
Oh, no,
now.
please go ahead, tall gamer.
Yeah. So now we've been saying that this is an injectable. Whenever I hear that, I always think in-office procedure. Are we talking at your office, or are we talking at a surgery center?
I mean, we're not even talking Motel 8.
Hey, depends.
Depends
on the
whether they're
cost.
sponsoring the podcast.
Exactly.
Motel hit us up.
I mean, you could do this at the surgery center if you were combined with something else, but honestly, I would say probably 99% of this is going to be done at the office, and whether it's a plastic surgeon, PA, nurse injector, anything like that. The most important part is the evaluation in terms of that. But from the patients that I've treated, they said this has been it's been more comfortable than any filler injections, and they describe it very similar to Botox. So I think something that people have tolerated extremely, extremely well.
Have you tried Fernando yet? Because he's
Well,
such a good report.
I
His
think
pain
you missed
scale is
earlier.
a
It's for
little bit different.
just a discrete few dimples.
My question is, how do you know, Dom?
I wasn't even going to go there.
I told you that we had a little hot dating topic for Donald later, so way to let the cat out of the bag. But no. They both had a hot date last night. They were both unreachable, so I'm not really sure what happened. Boom, boom, boom.
I do have a question. When Donald brought up surgical patients, what are you advising your surgical patients who may be considering this as an option? Somebody who maybe, let's say they have a BBL scheduled in a couple of weeks. What would you
A
tell
BBL by the
them?
BBL King?
That's right, by the BBL King himself. What would you tell them as far as post-op? How long do we need to wait for everything to settle before we explore doing QWO on those patients?
This is some of the things. QWO is definitely new in terms of being released to us since it just got its FDA approval. I wasn't part of the initial studies. Wish I was, because I think there's a lot of cool things, and there's actually some studies I'm trying to work on making a proposal for to get us started. But what I typically tell people is we got to do it at least 3 weeks before a BBL,
Okay.
and then I would make people wait at least 6 weeks after a BBL to do a treatment. Unlike Cellfina, I wouldn't do it at the same time. I don't know this, but I don't know how that's going to affect the fat that's been transferred. And until we know, I don't want to do anything that's going to decrease the result that patients may have. The one idea that I do like and I'd like to see over time, and we had tried to do this a little bit with Cellfina, it was just logistically much harder in terms of scheduling people for multiple procedures, is, if you can break up some of these bands, can we get patients to expand out a little bit more?
Yeah.
Again, I don't know that, but something I'd like to explore, because physiologically it does make some sense. And I'm not saying that this is going to double the size of your BBL, but for most people, projection and roundness is the hardest thing to do for a BBL. And you've seen this. I mean, we pump a lot of fat in there, but there's some safety issues in terms of the cannulas and so forth, and where we can put the fat, how much fat we can put, that limits some of that. And so what other things can we do to enhance the results without decreasing the safety profile?
Absolutely.
Great point. Oh, sorry. Did you have something to tell Gamer?
No.
I don't want to interrupt your flow. So thank you. Now that you have a big old game coming out, I want to make sure that we're giving you the respect you deserve.
I gave an affirmative.
Oh, okay.
That's what that was.
Because to your point, just not to get us too far off topic, and this is one of the things I think it's super, super important for people to realize, and it's one of the questions they ask you about the cellulite stuff, and I promise we do go over it in the consultation.
Oh,
the
I know,
cellulite's
I know.
not going to get better. And I do see patients before surgery, I promise.
I know you do. It's just those last minute things. Oh, I just thought about this. And I'm like, Dr. Frank's going to be in here in 10 minutes. I'm just going to tell you how to go to sleep.
Well, and you never do as much research on a topic until the day is coming.
Oh, 100% agree.
But so they, remember, we've changed how we do BBLs. It used to be very small cannulas. It used to be in the muscle, above the muscle, all places. So we've gone away from injecting in the muscle to avoid the fat emboli.
Yep.
We've gone to bigger cannulas, stiffer cannulas to avoid accidentally going into the muscle. We also get feedback from an anesthesia standpoint. Correct me if I'm wrong. We've gone away making sure that nobody's paralyzed or relaxed.
Yep. So we stop muscle relaxants early on in the case when you start doing the injection to the butt. That way you get some mechanical feedback if you hit any nerves or you hit anything that's sensitive. The muscle will actually give him tactile feedback.
Huh.
Yeah.
But and I think these are.
I just got another.
Dude, that's
one of
like
those
big
from
bowl.
Don-
You know what? I'm learning a lot today.
But I think those are some of the little nuggets that people don't realize that go into having a really well-trained team, and the team's not just the plastic surgeon, the nurse, but your anesthesia provider, someone that's really going to help with everything, because I think those things are just super, super important to making sure that safety is taken to the biggest possibility in terms of those things.
Absolutely.
And it's the little stuff like that, positioning. We flex the bed just a little bit so that cannula stays up, the antibiotic solution. And I'm getting off tangent here, but
No, but
it's
a lot
important.
goes into that, and I don't think the public perception of this is just kind of it's a boom 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 quick procedure that we just kind of knock out, but a lot goes into it. And like you said, I mean, it's constantly at the forefront of your mind. How can we make this safer? How can we achieve better results by not taking shortcuts, not injecting into the muscle, not doing things that are going to jeopardize safety? But like you said, coming up with newer, innovative techniques that may allow that butt to expand a little bit better and take on a better shape.
And having a team where everybody knows each other's emotions, it's almost like a choreographed dance.
It is, yeah.
It goes, and especially a surgery like a BBL where you're changing positions a bunch of times, you can go from a 5-hour to 3-hour surgery, and all you've changed is the efficiency. You haven't done anything in terms of the actual operating time.
Yep.
But for this, that the longer you go, directly proportional to increased risk of DVT, blood clots, other complications. And so, you don't want to hurry, but you want to be efficient.
That's the biggest thing. It's slow is smooth, smooth is fast, and it's being calculated and efficient with all the steps you're taking. When you do surgery, you are a very efficient surgeon. I see other guys reaching for things 3 times. If you are trying to accomplish a task, you're reaching for an instrument 1 time, taking care of that one thing, and then you're done. On to the next piece of the surgery. So, it's just all about being efficient and using that time wisely.
That's last thing I want to finish up with the BBL stuff. Just so people know, the other part of this because if you think about it, people say, well, and I used to get this with Cellfina all the time. Well, if you're doing a blade that's cutting these bands when you're doing the BBL and you're injecting the fat with the cannula, why are you not cutting these bands? Remember, we purposely use a very, very big blunt cannula to inject the fat that is made to miss the blood vessels, made to miss this. So unfortunately, it misses those bands too. But it's on purpose because we're trying to avoid any damage to the muscle that breaks that fascial plane that's going to let fat get it below that muscle or damage those veins that could cause that. So, we're doing it from a safety standpoint, not because we're trying to make you buy a second procedure.
Absolutely.
Awesome. Let's keep moving on. What else, Gilberto? What other questions about QWO can we answer for the world?
Should we talk about some of the outcomes and effects from a QWO treatment, like the bruising?
Ooh, I think that's a great one. This is an interesting phenomenon, and I can't really say that word. I practiced like 5,000 times, but you think about it, it's these tiny little injections. When you do Botox, these fillers, we actually get very little. With the QWO, you actually get surprising amount of bruising for the injections that you get. And the idea, I think you already did a little research on this. I think you already know the punchline.
I do.
Well, please.
Well, hit us
Fill
up,
us in.
man.
Hit us up with a little knowledge here.
So basically what QWO does, like Dr. Franco said, is it breaks down these fibrous septae, these like little tethers. But those fibrous septae have blood vessels that feed them. So when you're injecting them and you're breaking that up, you're essentially breaking up that blood vessel, which leads to a lot of bruising under the surface of the skin. So it's a significant amount of bruising from what I understand. I haven't trained on the procedure. I haven't done the procedure on any patients or anything like that. But my understanding is that it's a pretty profound amount of bruising. But that being said, the bruising clears up fairly quickly. And so, again, my understanding is that within a matter of 10 to 14 days or so after your treatment, the bruising has pretty much cleared up completely. And any subsequent treatments that are done after that, there's less bruising because there's less fibrous septae that you're treating. So it would make sense that there'd be less bruising.
And I think it's already attacked some of those walls that it's breaking down that's causing the bruising. Just like in the studies, people saw the biggest change between treatment 1 and 2. And then a little bit more and a little bit more at each treatment. In the studies, because they try to keep it very clean, they couldn't do any of the arnica lasers, compression garments, those type of things, because they just want to keep it across the board.
Yeah.
So in our practice, we've basically treated it like a BBL in terms of that bruising stuff. So we try to get people on the arnica and bromelain actually ahead of time. If you know you're going to get treated 3 or 4 days ahead of time, taking the arnica pills, and then you can continue them afterwards. My dad used to be on aspirin Plavix, and he would get a lot of bruises. And when he took it before, could see a night and day difference. That's when I really became a believer. There's some arnica gel or cream. You can help massage out some of that bruising afterwards directly on the butt. Unlike a BBL, you can massage out that bruising right afterwards. And then we've even pushed people to do some compression garments, because like any type of bruise stuff, if we can give it a little bit of compression, not that it's going to eliminate it, but anything you can do to help, because if you get some really dark bruising, we do worry a little bit about getting some staining from the iron in your blood. And so you don't want to have this perfectly smooth butt and then have some bruising staining, or some bruising that just lingers for a significant amount of time. And then, of course, if you really wanted to get it out even faster, we can send you over to Gilberto, and they do some lasers that can help get rid of the bruise. And you want to give people a quick snippet about what lasers or how you can zap those bruises?
So we
zap
have
that bruise.
Zap that bruise. So we have a laser in our office called V-beam by a company called Candela, and basically it targets the blood vessels and in this case the bruising. What we're essentially doing is we're drawing out all that bruising with this laser treatment, and just kind of helps speed up the process of clearing up that bruising. A pretty significant amount of time.
Reducing the ecchymosis.
The ecchymosis. There you go.
You're welcome.
I think it's nice if you're someone that really bruises, someone that you're worried about, something that can easily be done and passed on stuff. But it's real. And I think to your point, making sure people know, like, hey, if you're going to do this, you got, the pool party of the century, ours. I wouldn't do it the day before, maybe a month before. So all of that is good and set and ready. And then the other thing, remember, and I think we've alluded to it a couple times here, is the rule of threes is what I tell people. 3 treatments, 3 weeks apart. So if you want to get ready for summer, you better start ASAP.
Yep.
Yeah.
So we're getting into recovery talk right now, right? So you kind of talked about compression garments and things of that nature. Is this also a situation to where, like, after the treatment, you're telling patients to avoid sitting down as much, or like maybe when they go to sleep, they have to sleep a certain way?
You do you. You do you, boo.
So you can go right back. You can go right back to work.
You can go right back to work. You can get back to life, and that's again one of the things that has made it.
Oh, I mean, it's so different from Cellfina or any of the bigger treatments that you guys do in the OR.
But remember, it is several treatments,
Absolutely.
which is probably some of the flip side from like a Cellfina or something where you're doing one treatment and it's basically a one and done. Much like Gilberto's Tender Life. This is very, very different. This is more like Farmers Only, where you're trying to make a long-term relationship. In terms of that. Are you on that one?
Not yet, but I might.
Well, I'll let you take some pictures of my
he is in
pecan
the
orchard.
boots today.
Yeah, you are. Dang.
There we go.
I'm all choked up.
That's
I'm all choked up.
That's what the boots will do to you.
Because I just planning in terms of that it does take a little bit longer to get the full results, which is probably some of the downside from that. The one part that we skipped is anesthesia for this.
I'm always skipped over.
I'll tell you, it's been great because we haven't needed celebrity at all for this, which has been probably the best part of QWO. And we don't do numbing cream. I mean, if you really wanted it, you could, but it's honestly so quick, so fast. Unless you're Donald or Fernando, I mean, I don't think you need it. I really don't.
Nobody does numbing cream. I see how this place works.
So that's pretty economical for you then, huh?
Yeah. But I do think that's a really nice part. And to your point, people can jump right back into it. Do it over lunch, do it over their coffee break, come back, and then get right into life. But do planning. Hey, you're gonna have a bruised bottom for a little while, especially the first time.
And they can go back to like working out shortly thereafter? Or?
I typically, again, this is just my own thing. I typically tell people to stay away from hard workouts. If you want to take a nice stroll, that's fine. But anything where you're getting that blood pressure up, you're getting intense, I think it's going to increase your bruising. So I tell them for the first day or two to take it easy. But I mean, you can go to dinner, go to a movie, you want to go back to work, especially desk jobs, stuff like that. I think that's easy. People don't really have a ton of pain. It's just the bruising. And I think if you get your heart rate up, blood pressure up, it's gonna be hard.
Yeah.
Yeah. What else, Gilberto? What else can I answer for you?
I mean, you've pretty much gone over all the important stuff, in terms of like what your experience has been with actually treating patients, and what they feel and what they've kind of what kind of feedback they've given you. But can this be combined with other treatments? I know we talked a little bit about Cellfina, we talked a little bit about J plasma and BBL, and what are your thoughts on that?
Yeah, I think it and Cellfina typically are not combined together. Definitely seen some people that have had a Cellfina treatment and maybe had 1 or 2 or 3 little dots left that they wanted to try and treat. And if they're true cellulite, I think that's probably a worthwhile rather than doing the whole treatment again. Again, I think if somebody has a ton of dimples, if they're trying to do it at the same time as BBL, I think Cellfina is still a really great choice. I think if people are trying to do a single treatment, I think Cellfina is still a great option. So I think they both have their place, just like, sedation versus general anesthesia. No one is better for every situation.
Exactly. Yeah.
I'm just trying to wrap celebrity into this.
Really appreciate that. Man.
The other
anesthesia never gets any love.
we talked about BBL, Cellfina. The other kind of butt stuff that we do is M-Sculpt. And so, I think it all goes into hand in hand. So a lot of people who are going to be good quote candidates are going to be people who are very fit, people who already have a good butt to begin with. And the M-Sculpt just helps build that muscle, tighten that muscle a little bit, make you a little rounder. So no question you could do these around each other, and just, it all works in different areas to kind of, synergistically give you an amazing
result.
result.
Whole package.
Yeah.
I like that.
I dig it.
What kind of longevity are we seeing with these treatments?
That's a good question. And so I think it's going to be very similar to Cellfina in that right now it's stated to last a year, because that's what the study that got its FDA approval was reached out to. I think it's going to be like Cellfina, where that amount of time is going to expand over time over the next few years as we follow patients longer. It makes sense that this is going to last a good amount of time, because if you're getting rid of those bands, it's pretty rare that they're going to reattach down. But remember, there's no way to get rid of every band. If you gain weight, and this is the again going to the higher BMIs, you have fascial bands all across your buttock, because that's what keeps your skin moving. Your thighs, your legs, those bands are for a reason. When they get, like anything, too much, that's when you get the dimples, that's when you get the deformities. But that's what keeps our skin from in place and not just going.
Yeah. Oh, yeah.
And so keeps in a good spot. But if you think about it, if you keep filling that fat, right, those areas are going to keep getting, and then new stuff's going to pop up. So you can still get new cellulite if you gain weight and so forth like that. I think that's going to stay over time. I think as the studies go, it's going to be longer and longer and longer. Makes sense that this is a longer acting. I hate to use the word permanent, but I think you are doing a treatment that's going to have some longevity to it.
Awesome. That's cool. I think that's huge for patients long term, and it'll be nice to see in 2, 3, 4, 5 years out from when they did these initial QWO studies how these patients actually look.
And then the other big question we always get is cost.
I was just going to say that.
And I'll give you guys some ranges. Obviously, it's going to vary from practice to practice.
And butt cheek to butt cheek.
It depends on the number of dimples. So it's basically broken up into 2 categories. There's basically a small vial and a large vial. So 12 or less puts you in the small vial category. 12 to 24 puts you in the large vial. Over 24, then either you're going to have to do multiple sessions, or maybe you're not a quote candidate. Just depends. Sometimes if you're doing butt and thighs, it's easy to go over that number, and sometimes we'll do thighs and then butt and separate it like that.
Now, is this 12 or an under per cheek or total?
Total.
Okay.
Mm-hmm. So with the large vial, you could do 12 on each side, or some combination to that effect. Remember, and so, kind of can be broken up in a couple ways. And so a small vial will run you anywhere from 700 to 1,000 a vial. Most practices will do some package if you do all 3 to decrease the cost for you. The reason that we do a package to decrease the cost is we want you to do all 3 treatments, because you're going to get the best result that way.
Mm-hmm.
Remember, you're going to get some benefit, but not all the way there. And so, that way we're helping you get to a good spot where you're really super happy. Large vials have been anywhere from, I've seen anything from 900 all the way up to like 1,400 for the large vial in terms of treatment of that. And then again, typically some type of package if you do all 3, because people want you to be locked in. And some of those locked in so that you get the best result possible, and then some of the prices vary a little bit depending whether there's other stuff included in some of this stuff.
Cool.
Because like we talked about our facial stuff, it's the total butt, stuff type thing in terms of that. What any other last questions about El QWO before we move on to some good stuff?
I don't think so, man. I feel like that was a nice introduction to a new product.
I think it's exciting, and we had talked about there's a lot of things coming out this year that I think are pretty amazing. You know, we kind of got backlog with the craziness of 2020, so I think this is going to be an explosive year of new injectables, devices, things coming out. I mean, there's probably about 15 different products lined up over the next 3 years, and that's probably an understatement of the number of stuff that will come out.
Yeah.
And some of it's probably going to be spaced out just because they can't release a new product every week.
Yes. Innovative stuff.
Well, let's do a little behind the bovie.
Yeah.
I feel like you've been holding on to a nugget for a while.
Yeah. So like I mentioned earlier, so QWO is new to the cosmetic realm of things, but the product itself, the active ingredient, has actually been around for like 10 years. It's been used in different areas of medicine, different specialties. And so I thought it was pretty interesting that this product has been around for so long, but we're just now starting to hear about it on the cosmetic side of things. But yeah,
Which is true for a lot of products that get repurposed, retweaked, and kind of used when we find out, because even Botox, if you think about it, right, was actually used to treat spasms of the eye, and people are like, oh, shoot.
Wait a second.
You look good. Your spasms are gone, but you look good. So
Yeah.
I think it shows you how long it takes this stuff to come to market, which, again, is the safety thing.
right, exactly, because there's so many studies that have to take place to make sure that the product is safe for the general public for the indication that they're trying to get. So anyway, I thought I was kind of interesting that QWO, or the active ingredient in it, is being used, or has been used in like hand surgery and urology for different
Urology, that's an interesting one.
Yeah. It is interesting, isn't it?
Okay. Thank you. Thank you, Gilberto.
Yeah.
That seemed like that hit a personal side, so we'll let that go. Can we get to the fact or fiction? Anything?
You don't want any dimples there.
Any? Okay. And on that note, can we jump into fact or fiction?
Please.
Celebrity, most beautiful man. Any quotes for the? Oh no, let's do quotes. Let's do quotes of the day, because
Quote of
I
the
don't
day?
want to do fact or fiction because I was gonna ask Donald some stuff, but he off the air said, "Hey, don't put my business out there," and I was like, "Okay, I won't put your business out there. We won't talk about all the stuff you're doing with your free time now that you're done with the project. So we're gonna leave the people hanging and not tell them what you're doing with your free time on the internet with Craigslist. So we're gonna skip the Craigslist meetups
And Fernando.
Yeah, and Fernando. And so stuff just got a little too crazy. This is a family station. So with that, skip fact or fiction. We're getting to quote of the day.
So I've got a quote from Wayne Gretzky.
Ooh, they put my coffee down.
Yeah.
I'm excited
Great.
here.
Yeah. So
I used to watch this cartoon with him
Michael Jordan and
and
Bo
Bo Jackson.
Yeah. Love that cartoon.
Yeah.
So with QWO being somewhat of an innovative product in cosmetics, I thought, this kind of related. So Wayne Gretzky says, "I skate to where the puck is going, not where it has been."
Yeah. I feel like everyone in this room is an innovator, and we see the path,
We do.
and we're trying to guide people to that path of perfect booty bottoms and ready for the summer.
I like it. I completely agree, man.
Yeah.
You got to be forward thinking and trying to find where is that next innovation happening, where is there room for growth and innovation, and then try to meet that puck there, or meet those opportunities there, instead of focusing on what's here in the present. You got to be looking for new opportunities.
Looking towards the future.
And that's interesting, because it's one of the things that you and I have talked about in how you've kind of run your business a little bit different than some other models out there that I've been associated with, and I've been in a few different cities and a bunch of different hospitals. So, kind of took a little bit different approach, and probably beyond the scope of today's talk, but maybe one of these days we can do a little business one and share some of that. Because I think it's hey, just because something's worked in the past doesn't mean how we should do it going forward. So I thought this really applied to your business, and even some of the stuff Tall Gamer talked about, how they kind of worked some of the solutions of theirs. They kind of scratched the old way of converting games and kind of jumped to a kind of a new way. And sometimes you got to take a fresh start wipe the board clean.
A new paradigm.
Completely agree. And you've done very similar things with your practice in the sense that you're meeting these new technological innovations with open arms, and you're welcoming that into your practice instead of putting a wall up and being like, no, we're gonna do things the old way.
We've been good. We've been good.
We're good. We're gonna keep doing this. No, but doing that, I mean, that's only helped to grow your practice and make it what it is today. So
Appreciate it.
Yeah.
Any last comments before we wrap it up for the day?
That's good.
No, I'm excited to try this when we finally get it in our practice.
Awesome.
That's one of the things that was kind of interesting. The way they rolled it out was only to exclusive practices.
Boom.
Dang.
You're
look
welcome.
at you, big
So,
dog.
celebrity anesthesia put in a good word for me. So, on a final note, just want to say congratulations to Tall Gamer. I know he's been working on this project for a long time. So glad you got it done. I know it's always like a sigh of relief and excitement. It's your own gumbo of emotions to do that. So congratulations.
Yeah,
Thank you.
congrats, man.
Thank you all for listening to Plastic Surgery Untold, greatest podcast in the world, as voted by us. So we'll see you guys soon. A lot more exciting stuff to come. See ya. Bye.
Peace.